Good morning, Ohio, and thank you for joining us today for our first ever Facebook Live Town Hall, where we're going to give you updates from our senior leadership team and our special guest from the Ohio Association of Foodbanks. My name is Captain Jordan Kraft, the State Public Affairs Officer for the Ohio National Guard, and I'll be moderating today's Town Hall. Since this is our first ever Town Hall, please bear with us if we encounter any technical difficulties along the way. All right, let's go ahead and get started. General Harris, I'll pass it over to you for introductions.
Hi, I'm Major General John Harris. I'm the Adjutant General for Ohio.
Hi, I'm Joree Novotny. I'm the Director of External Affairs for the Ohio Association of Foodbanks.
Hi, I'm Colonel Matt Woodruff. I'm the Commander of Joint Task Force 37th.
Good morning, Colonel Gary McCue, Chief of the Joint Staff.
Great. Sir, would you provide an overall status update for our viewers on what the Ohio National Guard is currently doing?
Well, we have four major things going on right now. The first of which is probably most visible is the food pantry mission, where we are packaging, receiving, and transporting food for the Ohio Association of Foodbanks. The second mission is what we call a receive, stage, and store mission, where we're working with the warehouse for the Ohio Department of Health, helping to augment that very important operation right now. And the third thing that we have going on out in the field is a donation center for PPE. Lots of folks are calling in saying, I have some stuff to donate. We are running that out of our Sullivan Avenue Armory. The fourth line of effort, though, is right here in the headquarters, and that's we're frantically planning for potential future missions. We're paying attention to which way this COVID-19 goes, and we're preparing with other state agencies and state partners to respond as needed.
Great, thank you, sir. We'll go ahead and head into our Q&A portion. So over the last couple days, we've received a lot of questions across all of our social media platforms. So we've started pulling a couple of those to begin this Q&A. And as we start adding questions from our live feed and those start trickling in, we'll filter those into the conversation. So our first question, Joree, this will be for you. What's been the impact on the food bank missions so far?
Thank you. For context, in 2019, our 12 food banks distributed 230 million pounds of food to more than 1.6 million different Ohioans through our food pantry network. So on an average day, in normal times, we were serving about 25,000 different Ohioans each day. That number has doubled or even tripled in a lot of places in Ohio as workers are being displaced and kids are missing out on school meals. So the Guard members have been essential to helping us keep our operations going and ramp them up as need increases.
Thank you. Colonel Woodruff, would you add some impact from what our soldiers specifically are doing and how that's contributed to what Joree just mentioned?
Absolutely. So the team from Joint Task Force 37, in combination with the Ohio Food Bank volunteers, have processed over 1.2 million pounds of food as of right now. They've packaged over 800,000 pounds of that food, delivering meals at drive-through locations of over 4,000 meals, and overall deliveries over 550,000 pounds of food, driving approximately 2,000 miles.
2,000 miles, how much in reference? How many times did you get across the state of Ohio in just that time frame?
Thanks for the math question there. I'm going to guess you could do about 6 times across the state of Ohio.
Awesome, wow. Colonel McCue, Colonel Woodruff just mentioned the JTF. What's the JTF and what's Operation Steady Resolve, if they see that in our social media posts or in the news?
The Operation Steady Resolve is the nomenclature that we gave to this mission. We are out in the communities giving support to the folks, and that's just what it is. It's a steady state mission. We stood up the JTF, which is Air and Army and our state defense forces. So all of that together makes it a joint task force. We gave it to a standing brigade, which is the 37th Brigade, led by Colonel Woodruff. He took this team, this joint team, and we put them out in the field. And so now they report through the joint element of our headquarters to the Adjutant General.
Thank you, sir. General Harris, I know there's been some confusion about why an infantry brigade. So could you expand on why the 37th Infantry Brigade Combat Team was selected for this mission and not a transportation or support unit?
Sure. Well, primarily because the 37th is the most versatile unit in the Ohio National Guard inventory. We're blessed here in Ohio. We have a robust a robust set of capabilities. We're the fourth largest National Guard in the country, but the 37th Infantry Brigade brings a number of things to the response. First of all, it's self-contained. It is a unit of action in the Army vernacular. So it brings all the capability it needs to be a robust headquarters to include public affairs, logistics planning, personnel planning. But the second thing it brings is an inherent organic command and control structure. So because of the number of subordinate units it has, it's ideal for setting up command posts in the field, already having commanders and the senior leadership teams assigned. Those teams are built, and it makes it very easy to connect with our mission partners, in this case, the regional EMAs, regional hospital networks or whatever. So we're able to take that versatile headquarters and overlay it over existing structure, and they can operate from just about day one because of that capability.
Thank you, sir. Joree, a question about the food bank mission that we've seen a lot. How were the 12 food banks picked, and then where are they, and how can people get help?
Absolutely.
3 questions, sorry, but roll it all up in one.
Absolutely. I think there's a lot of misunderstanding about how our hunger relief network across Ohio works. We're actually a pretty sophisticated system that works hand in hand in local communities, at regional food banks, and then at the state and national level. So we have 12 food banks that operate regionally. They serve multi-county service areas, and they support about 3,600 different food pantries, soup kitchens, homeless shelters, and other feeding programs. So while those food banks that are hosting Guard members right now are the ones with the large warehouses that are handling millions of pounds of food, in certain 12 of those areas and counties, they're actually covering all 88 counties in Ohio by supporting those food pantries and soup kitchens, helping them modify how they do their work, doing a lot of prepackaged food to minimize person-to-person contact. And so if you think that you're not being served by the Guard members, trust me, you are. They're having a big impact.
Thank you, Joree. General Harris, a question that we've seen repeatedly in a lot of different formats. Where is the PPE, and why aren't our soldiers wearing masks for this mission? Could you explain a little bit on that question?
Well, there are two factors that are driving this. The first one being the fact that we've worked with the Department of Health to find out what the appropriate measures are that our soldiers, airmen, and our members of the Ohio Military Reserve should be in. And the measures that are put in place are adequate. Unless our soldiers or airmen are involved in direct patient care, the measures that are put in place are protective for our individuals. And the second thing is that we have to recognize that the PPE is a commodity right now that's in rare supply, or will very soon be if we don't curtail the spread of this disease. So we have to plan and prepare, and we have to be very measured in the way we use PPE while still protecting our soldiers and airmen. So if we know that we're going into a home to deliver a meal to someone who may have a disability, then we suspect COVID-19, then our folks are going to be in PPE. But otherwise, we're confident that the measures as prescribed by the Department of Health are adequate.
Thank you, sir. Colonel Woodruff, a question that we saw a couple days ago is the Ohio National Guard blocking roads or preventing access or entry to the state with the soldiers we have out in the community?
No. Our soldiers, our airmen, our Ohio Military Reserve members are currently serving the missions that were discussed earlier. We are primarily providing support to the Ohio Association of Foodbanks, and then we have a couple of lower level secondary missions of the RSS site support and the PPE reception station at the Sullivan Avenue Armory.
Thank you, sir. Colonel McCue, how many Ohio National Guard members have been activated so far?
So far, we're not quite 500, so just over 450, about 475.
And we started with 400, so we brought on a couple more individuals to support this mission, and they're supporting largely the food bank mission?
That is correct, as well as the RSS site and the PPE.
Thank you. Colonel Woodruff, you're using a military unit, so the 37th IBCT and the subordinate units, and within the last couple of years they've deployed. So what's different about a deployment to this humanitarian mission and state active duty?
I think this is one of the core missions of the National Guard. I think this is one of the key reasons why we serve. This is citizens of Ohio serving their own communities. This is your brother, your sister, your father, your mother, your cousins, helping other Ohioans. This is Ohioans serving Ohioans. And this is the exciting thing about this mission is this is what we're developed and what we're designed to do. When we go overseas, sometimes you don't see the immediate impact of your actions and the operations that you partake in. But when we're on a domestic mission like this, you see the smiles on the citizens and your neighbors' faces when you're delivering a meal or you're supporting that community.
Thank you, sir. General Harris, one thing that not just Ohio is seeing in our social media feeds, but in states across the country, every 54 states and territories have dealt with this rumor about martial law. Is the Ohio National Guard positioning itself to implement martial law?
We have had no discussion about implementing martial law. The only discussion we've had is how do we counter this misinformation that's flying around out there in the social media space. Look, as was stated earlier by Colonel Woodruff, these are Ohioans serving Ohioans. This isn't some unknown military entity parachuting into your state to enforce some kind of draconian law or policy. These are folks who are stepping in to help their communities. And any help that we can get from the community to debunk that myth is helpful for us. Trust is the most important thing that we carry into the community. And we certainly don't want that trust eroded by misinformation.
Thank you, sir. Joree, we've been getting a lot of comments about how people can receive donations or how they can get food delivery. Could you talk about how if people need help, if they're immunocompromised or if they're at their homes and not able to go out, how would they request help from the food bank?
Thank you. Yes, I'm happy to. I would encourage anyone who is in need of help to visit our website. It's ohiofoodbanks.org/coronavirus. We've set up a separate page that houses information about how you can get help locally and also how you can offer help if you're able. Keep in mind that these are local folks, just as the Guard members are from your local communities. These are also your neighbors and friends who are staff and volunteers of these food banks who are working 24/7 to keep food flowing into their communities. We're doing the absolute best we can under the very unique and unprecedented circumstances. So I ask that you give us grace, keep calling us if you don't get the help you need right away, and trust that we want to do everything we can to help you.
Thank you, Joree. One question that came in through our live feed, General Harris, that I'll direct to you is there are people wondering, is there any potential of us recalling the inactive Ready Reserve or even retired National Guard members?
Well, there is potential for recalling specific skill sets right now. I can tell you the Army has a call out for retired physicians and other providers simply because that's where the surge capacity is going to be needed. The good thing, again, about Ohio is that we're the 4th largest National Guard in the country. When you pair with that the Ohio Military Reserve and the Ohio Naval Militia, we have a pretty robust response capability in Ohio. So if we were to pull folks from retirement or request that folks come out of retirement, it would be for specific skill sets. But our footprint is large enough here in Ohio that we could pretty much respond to just about anything.
Thank you, sir. Colonel Woodruff, could you let us know, there's people that keep commenting about how they can help as an individual, if they could volunteer or what they could do to help this initiative?
Absolutely. So what I would encourage anyone that's interested in volunteering is first, stay at home, like the governor's declaration asks. Continue to posture the state to prohibit the spread of the coronavirus. Secondarily, I would say if you're interested in volunteering, once this passes, then go to your local food bank, go to your local soup kitchen, go to your local community area and volunteer then. My hope in all of this is that with over 400 soldiers, airmen, and OHMR members participating in this food bank operation, that at the end of this, we'll have volunteers to the food banks supporting them after this.
Joree, how are guardsmen protecting themselves, and not even just guardsmen, but the volunteers at food banks when they're packaging food? What are some measures that each of our food banks are taking?
Thank you. Yeah, we've quickly had to make a lot of modifications to how we normally operate. Again, we've been stressing for many years access to fresh, healthy, perishable foods for our low-income clients in need who are struggling with hunger and food insecurity. So traditionally, for several years, folks have come to our food pantries to shop just like they would at a grocery store. We also have a lot of hot meal programs that normally serve food in congregate settings when everyone eats in a community-style platform like they would at a restaurant. So as you can imagine, a lot of how we normally do our business has changed in the past couple of weeks. We've quickly shifted to doing pre-packaged foods, which the Guard members are helping us to package and get out into our communities through a lot of drive-through distributions to prevent person-to-person contact. As far as Guard members and our other volunteers and staff in our warehouses, we're working quickly to make sure that we comply with all of the health orders contained in the governor's stay-at-home order to make sure that we're maintaining social distancing and protecting all of our workforce.
Great, thank you. One question that just came in from the live feed is the HERF going to be responding at all? So I don't know, Colonel McCue or General Harris, who might want to respond to that. Colonel McCue, has that been a conversation you've had downstairs, or General Harris, but is the HERF going to be activated?
Well, the HERF's a very specific capability, and the decontamination, triage, search and rescue aspects of the HERF, I can't imagine specifically being utilized in this kind of event. I never say never, but if the HERF were activated, again, it would probably be for the command and control structure and for the expertise. If this response grows, and we're preparing for every scenario, if this response grows and we have to stand up another joint task force size headquarters as commanded by Colonel Woodruff, that's a possibility, an option. Would it do the traditional search and rescue, decontamination, triage type missions? I don't think so. I don't see that scenario playing out, but we could certainly stand it up and use those capabilities in some other kind of way. The HERF is designed for that major catastrophic kind of event, building collapse, structural collapses in a contaminated environment. Again, I don't see us employing it that way, but I do see that we could have the potential to call it out for its versatility. And the important point to make here is that this is the beauty of the Guard. When we talk about units that deploy, also responding in the community, it's what we do. That's the versatility. And we're doubly versatile because of the civilian skill sets that Guardsmen bring to the response with them. So a person may be a medic in the National Guard, and they could be a plumber in their civilian job, or vice versa. So we bring double sets of skills for just about every Guardsman to the response. And that gives us incredible versatility to respond to just about anything.
Thank you, sir. And General Harris, you just talked about all the different diverse capabilities of the Ohio National Guard. Colonel McCue, could you expand a little bit? What type of capabilities do we have that can help in this fight against coronavirus?
Yes, as the general said, we're very diverse in Ohio. We're one of the largest in the nation. We have 4 air wings. A lot of the geographically separated units on the air side, and in the Army, we're one of the largest in the nation. So whether it's transportations, logistics, communications, we're very diverse, and we have a lot of depth. The greatest thing we bring are our people. So we have thousands of folks that are ready to serve in these communities when called upon.
Thank you, sir. General Harris, about how long could you even estimate that you see the Guard performing these jobs?
I'd love to take a swag at that, but I can't. And I will tell you that the folks who are watching this broadcast get a vote in this, because quite frankly, we're in this for the duration, and the duration will be determined by how effective the governor's directive measures are. We know that we're out to flatten the curve and not overrun our state's medical capacities. And if we do that, and if we're successful, this could be maybe not a non-event, but not a cataclysmic event for the state of Ohio. So the important part is every person watching this gets a vote in this by staying put, by reducing the vectors, the movement of this virus, slowing the rate of infection. We can determine how significant this is and how long this lasts, but we all have to do it together. So I can't give you an answer on when it's going to be over and how long we're going to be on mission, but I can tell you the best way to get there is for everyone to implement the measures that the governor's directed.
Thank you, sir. A question, Colonel Woodruff, that I'll direct to you that we've seen over the last several days is what happens if a soldier or airman who's on mission gets sick, if they have a fever? Do they go home? How do we make sure that they're not say when they go out to the
Sure.
community?
So every day when the soldiers show up for work, whether it's at a food bank location or whether it's at the Joint Task Force headquarters, if it's at the Joint Task Force headquarters, they do a self-assessment. We did a baseline the first day they came on state active duty orders. We took their temperatures. From that day forward, for the personnel only in the Joint Task Force, they do a self-assessment, take their own temperature, and then they come to work. If you're at the food bank locations, we have medics that are set up that will take temperatures. And if your temperature exceeds 100.5, then you go home. You do not come off orders unless you are a suspect to potentially have COVID-19. If you have COVID-19 or you get injured, you would come off state active duty orders at that time, and then you would go through the Bureau of Workmen's Compensation to get the care that you're entitled to.
Thank you, sir. Joree, a question that we've seen yesterday and today even, if we wanted to donate food, if I'm a civilian out in the community and I want to help and I'm willing to donate food, is there a way to do so, or what would you advise?
Thank you. Yeah, one of the few wonderful things about what this crisis has done is just shine a huge light on the generosity of all of the Ohioans across the state, and we're so grateful for all of your willingness and interest in helping us to serve the people that we need to serve right now who are vulnerable and need our help. With that said, in normal times, again, we would accept food donations at our food banks from civilians who would be operating food drives in their communities. We're encouraging you instead, if you are able to make cash donations. One, because we don't want to have more people flooding to our warehouses and increasing the risk of person-to-person contact to bring those foods. Another reason is that it takes extra manpower to sort through all of those assorted goods, and bringing those in creates more work for our limited workforce and guard members. We're really trying to use the cash we have on hand and our partnerships in the food manufacturing and retail community, as well as our federal and state funded commodities, to make sure that we're getting the right foods that people need, and we can buy those foods and purchase those foods at a much lower rate than you can in your local store. We also want to make sure that we're not putting additional pressure on our local grocers by having generous donors rush into their local grocery store to purchase food to then deliver through our channels. So we encourage you, only if you're able, again, to please visit our website, ohiofoodbanks.org/coronavirus, or your local food bank's website to make a cash donation.
Thank you, Joree. Colonel McCue, what does it take to coordinate all these efforts?
It takes a lot of dedicated people. So here at headquarters, we have planning teams, 2 or 3. And on those teams, there are several folks. And a lot of those folks are worked on current ops. We call it COOPS. And we have a couple teams that are working on our future ops. So they're constantly evaluating, thinking into the future, talking to the folks across the street at the EMA, Ohio EMA, for potential future missions. But it takes a large group of highly motivated, talented individuals.
Thank you, sir. One question that came in, General Harris, I'll direct it to you. If someone was wanting to help contribute to the current efforts by joining the Ohio National Guard or the Ohio Military Reserve, is that possible?
Oh, absolutely. They could certainly, we welcome them if they meet the qualifications to join the Ohio National Guard or the OMR. The challenge would be getting through the appropriate training and qualification in order to be a part of this response. That would be very difficult to achieve. We meet the exact same training standards as the active component, so you'd have to go to basic and your technical training, and this would probably be done by the time you got back. But we certainly encourage folks to go to ong.ohio.gov, take a look at that website if you're interested, gain more information, go talk to a recruiter. Because again, we are the community supporting the community through a variety of missions, and we'd be happy to have you.
May I add on to that?
Sure.
If you're a former member of the Ohio National Guard and meet the qualifications, you could rejoin our forces and help with this mission. And I would, again, encourage you to locate your closest recruiter and set up an appointment so that you can come back into our team.
Thank you, sir. Talking about donations, we've seen a couple different questions throughout the last couple days about medical supplies. and use across, the civilian market, how we can donate medical supplies. Is there any venue for individuals to donate medical supplies, Colonel Woodruff?
So I would say there's a couple options. First, if you're in your community and you have a hospital in your community, contact your local hospital, look at their website. Most of them have some sort of donation procedures and times that you can donate PPE to them. You can also contact your local county EMA, and if you go through your county emergency management agency, they'll have options for you to donate. And then finally, at the Sullivan Avenue Armory here in Columbus, Ohio, Franklin County, you also have an option to donate PPE to that site.
Thank you, sir. Colonel Harris, a question we got from the live feed. What would someone do, or what would you advise them to do with the partnerships we have with our different state agencies if they had their hours at work and got cut back and they're needing support?
Well, depends on the kind of support. The Ohio Department of Jobs and Family Services has significantly ramped up the services they provide, and as you know, the federal government has now authorized support and services to be administered in most cases by the state. So the best bet will be to contact Department of Jobs and Family Services, go to their website, look at the offerings, whether that's, as you know, enhanced unemployment insurance that was recently authorized, or the other myriad of resources that they provide. And right in their own communities, there are a number of for-profit, non-profit organizations that are probably willing to help too.
Thank you, sir. A back-to-back question for you, General Harris. A question we've seen is, why have the Ohio National Guard medics or doctors or nurses not been deployed in their military capacity on state active duty to support hospitals?
It's a terrific question for whoever asked it out there, because it comes up often. And for every response, each type of response, and keep in mind, we train for a myriad of responses here in the homeland. For each response, we have to do an analysis of what's available to us. And when it comes to our medical response in this case, we consider most of our medical providers not available because it's a net sum process or offering for Ohio. If we take those people and mobilize them in a state active duty status, we're pulling those providers from the hospital in which they work. We're pulling those nurses from the hospital in which they work. So we've done an assessment, and we have a few providers, a dermatologist, or now that elective surgeries have been tabled for a while, there are some of those providers that are available to us, but the numbers are pretty small. So it's more important for us not to degrade the ability of the community to take care of itself by building a National Guard response. So in this case, again, it's a net zero gain. So we don't consider ourselves a medical provider in this case for that reason.
Thank you, sir. A question, I think that's a great one that just came in on our live feed is, and Colonel Woodruff, maybe you can answer this question. What resources are out there for our soldiers and airmen and their families that are on active duty, or just in the community? They're mostly civilian citizen soldiers, right?
Mm-hmm.
So some of them may be off work. So where would you direct them if they needed assistance or resources during this time?
Absolutely. So in our operations order that we published from Joint Task Force 37, we had a list of resources that Julie Blake's team had developed. Julie Blake is the director of Family Readiness and Warrior Support at the state headquarters here in Columbus. So I would recommend, one, reach out to your family readiness groups, reach out to your chain of command, and also then reach out to your local TFAC coordinators. There are resources, and we have a resource sheet that is available for every soldier, airman, and member of the Ohio Military Reserve.
Thank you, sir. As we begin to wrap up our Q&A portion, one question looking to the future, some different missions that have been discussed. Colonel McCue, could you maybe talk about what potential missions that we're looking at for the future?
We are working closely with Ohio EMA across the street here. And if you watch what's going on in the rest of the nation, especially the large cities, that's what concerns us most. The fact that folks are at home, stay at home, this is the most important thing you can do, because if our hospital system is overwhelmed, that is first and foremost on our minds. We take our cue from across the street from EMA, and we stand ready to assist them in whatever endeavor that may be. And hopefully there won't be one. Hopefully this will be a low enough effect that that is not needed.
Thank you, sir. Just one comment. We do offer virtual recruiting instead of walking into an in-store facility. A storefront recruiting station. So just keep that in mind. There are resources on our website about joining the National Guard. Our website's ong.ohio.gov, and there is a link that you can click on for join for information on how to get connected to a recruiter virtually by telephone. One last question that we could ask is, what's the likelihood that we are going to activate additional Guard members, just to close?
Well, we move forward with a planning assumption that it's very likely. And that's our responsibility, is to be prepared. So that means that we have to anticipate. So as I mentioned earlier, we're looking at the entire matrix of potential missions as we plan for those. And I full well anticipate whether that means the food bank mission increases, that whether that means that we pick up at I full well anticipate we'll pick up additional missions around expanding this medical facility capacity. This is the number one thing on the mind of our governor and our senior leaders here in the state, is to ensure that we do not have to turn Ohioans away either from a ventilator or from a hospital bed because we've exceeded the capacity. So those are the future kinds of missions we're looking at, and I certainly anticipate bringing more folks on board to do that.
Thank you, sir. In closing, is there anything that you'd like the public to know about what the Ohio National Guard is doing before we turn it over to Joree for a message of thanks?
Yes, yeah. I'd like to leave you with this. Generally, when the National Guard responds, we consider it. We never respond on our own. We don't do that. We respond as a part of a whole of government approach. We respond to support other state entities, whether that is a civic organization, state patrol, Jobs and Family Services, whatever. That's who we support. In this case, what makes it unique is this is a whole of society response. Every person is a participant in determining whether this is a successful or not successful response. So I can't emphasize enough, our response has to be orchestrated, it has to be synchronized. We all have to do this at the same time to achieve our intended effects. So staying home, you're contributing to the effort. You may not be hauling pallets of food or anything around visible in the community, but you're contributing just as much by staying put, because this enemy moves when you move. This enemy transmits when we move. So as we minimize movement, we take away the strength of the enemy and we protect Ohioans. So this is a whole of society approach, and you are a participant. So thank you for that.
And I just want to echo a similar thanks. First, of course, I want to thank, on behalf of all of our food banks, Governor DeWine, Lieutenant Governor Husted, Ohio Director of the Ohio Department of Health, Dr. Amy Acton, of course, the General and the Colonels and everyone on the Ohio National Guard team who's made this possible to support our mission and keep us going. But of course, I mostly want to thank each of the Guard members who are right now serving at our food banks, and all of their families who are making a sacrifice to put them in the front lines to help us do this work. I would ask, if you're a parent with a kid at home who doesn't have much to do right now, would you write a thank you note for your Guard member and send it to their food bank? Let them know that they are family and that we're so grateful for them.
Thank you, Joree. And I just want to say thanks for all of our viewers. This concludes our Facebook Town Hall Live, and thank you for tuning in.